Psychiatry, Pathology, Trauma, and Stress-Related Disorders. All right, so first we have adjustment disorder. For adjustment disorder, what you need to know is that you have emotional symptoms occurring less than 3 months after a stressor. All right, so if you had some type of like divorce or illness or some type of severe event that occurred, and within 3 months of that event, you have emotional or behavioral symptoms like anxiety, outbursts, then it's probably going to be adjustment disorder. It lasts less than 6 months. Okay, so after 6 months from that stressor, from the onset of that stressor, if you still have symptoms, it's not adjustment disorder. All right, very, very key, very important. Treatment is just CBT. Okay, now next is going to be PTSD. PTSD is kind of an array of symptoms that occurs, and you're going to see like flashbacks, nightmares, hypervigilance for greater than 1 month. It's very important that you know that it's for longer than a month. And those 3 symptoms that I said, flashbacks, nightmares, and hypervigilance, are very high yield. Okay, so that's how they're normally going to present. So it's going to be persistent hyperarousal. They have avoidance of associated stimuli. They get intrusive re-experiencing of the event, which is the nightmares and flashbacks. And they have changes in mood, like they'll seem fearful or horrified. They'll be in distress. Okay, but remember, these disturbances have to occur for greater than a month to be associated with PTSD. And obviously, it has to be after a traumatic event. So the flashbacks, nightmares is going to be in association to that previous traumatic event. All right. Now, first line treatment is going to be CBT, SSRIs, right? But you could give prazosin, which can help reduce nightmares, and that's going to be our alpha medication. Acute stress disorder is going to be the same symptoms as PTSD, but they last anywhere between 3 days and 1 month. Okay, so just keep in mind that acute stress disorder is PTSD, but less than 1 month, and it has some type of dissociative symptoms, unlike PTSD. But pretty much the timeline here is going to help you. So once again, adjustment disorder is going to be within 3 months of issue and lasts less than 6 months of the issue. PTSD is going to last greater than a month, and acute stress disorder is going to be the same as PTSD, but lasts less than a month. All right. So that's our key features for our trauma and stress-related disorders.